thing that my mind goes to, and I gotta get off soapboxes, but it just there's been so many different things going on that I get on these soapboxes. The other thing that my mind really picked up, and I want to make sure that it's making the right assumption about what you're saying. You know, we talk about burnout a lot in healthcare, and it's a real problem. It is definitely a real thing. The one thing that you said, though, it seemed like inherently in this is that, at least for you, and there's different values for other people, leaning into almost like the chaos, leaning in almost to the pace of primary care, which just intuitively, I think a lot of people say, oh, that's going to burn me out. That's going to cause me a lot more. It almost seemed like it was, I don't know if healing's the right word, but it was engaging. It was inspiring because it allowed you to live out your values. And that's something we talk about with our trainees all the time. Like, leaning out doesn't necessarily mean less burnout. A lot of times that burns us out more. I don't know. I want to make sure, am I my mind picking up on what you were saying there?
Yeah. And I know the tension that you're trying to ride there, right? So on the one hand, we don't want to diminish, we don't diminish some of the systemic issues with healthcare that need to be fixed, right? I mean, there's way too much pressure put on primary care docs to do their jobs effectively, and way too many demands on their time, on their bandwidth. They're on the screens way too much, way too many clicks, and they're held accountable in ways that don't really make sense for the outcomes that really matter to patients. So we don't want to minimize those realities. I would also say that the training of physicians needs to be revamped. I think it's crazy. I have a physician wife. I can speak to that. Yeah, it's absurd what they put these poor, caring human beings through, sort of to prepare them for, I guess, a lifetime of lashing, I guess. It's like, so there's lots of things that need to change in the system. On the other side, I totally get what you're saying as well, that primary care does has a mission. And when you do tap into that mission as a team and as an individual, that is energizing and that is protective. And things become counterintuitive, as is often the case when you lean into paradoxes. You find a whole new way of seeing the stressor. You find a whole new way of seeing the difficulty. So, for example, a tangible example is when I started that clinic, started that program at Lawndale. I literally in my interview, this is why I say I don't know how they hired me, but in my interview, I told Bruce Miller, the CEO, who's a great friend. I respect him tremendously. I thank him for hiring me. But I told him, I said, I am almost embarrassed to say this out loud. I said, I will only work with 4 to 5 families. That's it, David. Now you realize that Bruce Miller was heading up a clinic at the time, about 60,000 patient visits annually, right? But I'm going to work with 4 to 5 families. Why? Because I had this, part of what was ingrained in me early on was this, in my training, was this idea that a family-oriented approach was going to be the key and intensive work was going to be the key. In other words, I want to go deep with families and really produce real change in their lives. That's the mindset I had. So I had 4 to 5 families, and I'll do the program development on the side with the other time. That was an utter disaster from the get-go, obviously, right? But when part of that was fear. It was fear that if, like I said, I open up my schedule and I'm going to be overwhelmed and it's going to be so hard to carry the burden of seeing all these patients with really serious psychosocial and mental health and medical issues, is this fear of being overwhelmed by all that. When I switched my practice over and really started, as to use your word, lean in to what primary care was, lean into a little bit of the chaos of what it means to kind of go through a day without knowing exactly who you're going to see, when you're going to see them, how you time having to see 2 patients at the same time, all that kind of stuff. When you lean into that in a productive team-based way, so it's not just, it's not you being a hero. It's really you being part of a team, trying to do their best to care for these folks. And then you say, okay, I'm going to take 12 minutes with this patient, and then I'm going to take 20 minutes with that one, and that one's going to need 40 from me. This one, I'm just going to do a check-in for 5 minutes. You then begin to be energized actually by some of some of the chaos and the goodness that you find in that chaos of a team coming together to really do their very best to care for the patient in front of them in the situation that you have in front of you that day. And so, yes, it can feel sometimes like out of control, but I think that's kind of the lesson in a way. We need to be out of control. We need to loosen the bounds of what we do professionally, how we think of ourselves professionally, in order to find the true value that our profession brings. And our profession doesn't bring the value of a 50-minute visit.
Correct.
Our profession brings a value of a person who's specifically attuned to the human experience and what it takes to overcome the challenges that human beings experience, both on the physical, emotional, and behavioral and communal level. That's what we bring to the table. So whatever I'm going to bring in 12 minutes, I'm going to bring all of me to those 12 minutes, and I'm going to bring all of me to those 20 minutes. And yes, I get tired. I get burnt out. I get times, I shouldn't say I get burnt out, but I get tired more than anything else. I get tired and exhausted. And yes, there are systemic issues sometimes in the clinics that I've worked at where just things are frustrating and flows are not quite perfect and all that kind of thing. And yes, like any community, there's strife between medical systems and providers and, some team dynamics that you have to deal with. All of that is part of the chaos too. But again, if you lean into that, you really see yourselves and say, wait a second, I have a role to play here. I can actually help this team function better. I can bring something different. And then we together do more than any of us individually could do. So I think that's where you ride that tension of where, things need to change to really promote healthy teams in virtually every clinic in America. And at the same time, when you're able to lean in, you actually become a better problem solver of those things that need to change.
Absolutely. And I really just appreciate that. Again, it just gets me, it gets me excited. And you're absolutely right. We talk about burnout a lot with our, obviously our residents, and it is just eye-opening to see what, physicians go through, and really any medical provider, about their training and the expectations and these 80-hour weeks. And it really is, it's inhuman. And in that, though, there's so much, especially primary care, there's so much opportunity, I think, for reinforcement. There's so much opportunity for us to feel engaged when we do lean in a lot of ways. And I like how you said that doesn't mean that you're not tired. It doesn't mean that you're not exhausted. It doesn't mean that some days weren't good days. It just means that, and I like the word that you use, protective, that it can be energizing and protective. That's really cool.